part of the reason why I'm here, I'll kind of introduce myself, let you know who I am, what I do. I'm the clinical coordinator for the surgical tech program. My name's Miss Lewick, or Miss S is fine. If you see me in the hallway, you have a question, I'm not a small child running around. I can actually answer your questions and help you. So something to know that we're going to go over the PowerPoint, and that's all of the information that you're going to be like tested on an exam. Do you understand what sterile means? Do you understand the purpose of sterility? Basically what we're trying to do is get contents onto a field that has been established that you cannot touch unless you're sterile. So you have to kind of play inbounds and out of bounds. And once you get into the sterile conscience mode, you can no longer touch things, regular inanimate objects. You have to be sterile in order to touch those. And so that's the inside and outside of bounds we're going to talk about. So what I'll do is go ahead and get started with the presentation. This is based off AORN standards, exactly what you'd be required to follow if you walked into an operating room. So we want to make sure that you know you're following the gold standard. If I see anything in the video that I think, oh, that could be questionable, I will point it out. But it's pretty straightforward. Most of this information you can find online if you needed a handout. So I didn't print the handouts. I left it in the presentation. If you need an example, we can get those emailed to you. So we'll start with this presentation, and then from there we'll go right into demonstration, and then we'll practice as soon as possible. So this is implementing the sterile field and why.
They've agreed to something that they don't know they've agreed to. So be sure to grab the doctor and say, hey, this dang doctor does not understand that you're going to be cutting off her leg. I need you to please explain it a little better so that she has a fuller grasp of what's going on. Be sure to perform the appropriate hand hygiene prior to performing your sterile procedure. If it's going to be in the operating room, of course, you're going to do a surgical scrub. However, if you're a bedside, when it's like you're in a catheter, great care, or something along those lines, simple hand washing will soak you water and turn your hands dry prior to donning your sterile gloves should be sufficient. Alright, so let's establish a sterile field. The longer your field is established, the easier it is for it to become contaminated. This is why it is best practice to establish your sterile field immediately prior to use. Keep in mind that only sterile items should enter your field. If a sterile item comes in contact with any kind of non-sterile item, then the sterile item would be considered contaminated and removed from the sterile field. The field is considered at waist level. Anything below the waist is considered a contaminated area. Always keep your field within your field of vision. Do not turn your back on your sterile field, as this increases an opportunity for contamination. If there is a need to manipulate the placement of your field and you are not yet sterile, you can use the outer 1 to 2 inches of the field for adjustment. For example, if you see in the picture here, they have a Foley catheter box. The outer 2 inches of that field is considered contaminated. You can adjust the box location based on that. However, if you're gloved and sterile, then you would touch within the sterile area to adjust movement. Avoid crossing your hands like your wrists. Do not cross one hand over the other. This can increase the risk for contamination.
Don't do that.
Crossover. When you're establishing your field and during the use of the field, you want to move slowly and deliberately. Everything you do has a purpose. By being mindful of where your hands are at all times, where all of your items are located at all times, this decreases the risk for contamination and increases the ability to maintain sterility. Take a look at this picture here. This is an example of establishing a sterile field. You'll see in A, they're opening the tab that is farthest away from you. When you're opening a sterile field, you're going to open the flap farthest away from you first. Then you open your side flaps, then the flap closest to you. This prevents you from crossing your field. This prevents you from contaminating your area of sterility. And be sure to remember that when you are opening and establishing the sterile field, that you need to move slowly and deliberately to ensure sterility and to avoid contamination. To maintain the sterile field, keep in mind, sterile field remains waist level. Field of vision, you're not turning your back on it. Only sterile items are entering the field. Contaminated items are kept out of the field. If you consider that if there's any doubt at all of the sterility of an item, it's contaminated. Regardless, consider it contaminated. Sterile items are only used for that immediate patient. If you're opening a forceps and you're going to be using it in a procedure, it is sterile at the moment you open it. You use it on that patient, you send it down to central sterile processing to be re-sterilized for the next patient. Non-sterile persons or items are not to contact the sterile field. If they come in contact with the sterile field is compromised and you are to scrap the field, start all over. Only sterile persons that are gown and gloved or gloved, depending on the type of procedure that's being performed, may be in contact with the sterile field. Still, do not cross the field. Keep in mind that if you do accidentally contaminate your field, there is no shame in admitting, hey, I contaminated this, I've got to start over. Your patient safety requires you to do that. It is imperative that you maintain integrity for the sterile field. If you know it's contaminated, scrap it, start all over. How do I know I've contaminated my field?
These are all
Take a
great
look at these
examples.
pictures here. Picture one. You've got a non-sterile person passing off something, perhaps a medication, to your scrub personnel. Notice the gown is touching the sterile field. That contaminates the field. Notice her arm, how far across the field it reaches. That too is considered contaminating your field. Expired items. Do not provide expired items to the sterile field. Always check your expiration dates on your packaged items. Anything that is expired is considered contaminated. Some items, dependent on the method of sterilization, will have an expiration date and must be re-sterilized if the expiration date has come to pass. Do not put your hands below your waist. The field is considered waist level and higher. Anything below that, contaminated.
So you stay in a box.
Non-sterile items touching the field. Again, look at the scrub nurse there. The mask string has come untied and is within the field range. Sneezing, coughing, or talking over your field can introduce contaminants. Water can cause strike-through contamination, so avoid getting your field wet unless there are specified areas for water or sterile saline. If water needs to be added to the field or saline needs to be added to the field, it must be sterile and placed in specified areas. For example, irrigation waters, basins, or bowls. Instruments with damaged packaging. Those are considered contaminated. The integrity of a sterile package or drape is destroyed by perforation, puncture, or strike through, the soaking of moisture through non-sterile layers into sterile layers, and vice versa.
So something like
So
that.
when you're using your sterile field, you have to be cognizant of everything going on. This is why I reiterate over and over again, the use of slow and deliberate movement when introducing items, when using items. Always know where items are to maintain the sterility of your field. We're going to be introducing some items to the sterile field. Make sure you're moving slowly and deliberately. Check the packaging to determine the layers of the packaging. What layer is considered sterile? What layer is considered contaminated? Some packaging will come with sterility indicators that shows you that when the package passed through, say, steam processing, it reached the appropriate temperature to sterilize its contents. So you want to make sure that the sterility indicator has been checked off or marked off. Verify the item has not passed its expiration date. Again, if it's expired, it's considered contaminated. Use the same principle of touching outer edges like you would when opening a drape or establishing your field. Same with introducing items to the field. Do not let the package touch the field. You're opening it very carefully, very slowly, very deliberately to introduce it to the field. You're only introducing sterile items, instruments, or solutions to your field. If you're going to be administering or providing medication to the field, you're going to use an administration adapter to pour it from a bag or a vial. And you're gonna be sure to check the expiration date of the medication and make sure that your scrub personnel labels the medication appropriately. Prior to introducing the medication to the field, you're gonna state what the medication is and the expiration date of the medication, and then it will be introduced. And as you do it, you'll also allow the scrub personnel to view the vial so that they know that they're getting the same thing you're stating you're getting. By labeling appropriately and administering appropriately, you avoid issues like medication errors. So now we know how to establish a field.
So that's just a basic overview. There's a lot entailed in, sterilizing instruments and all that. For what your purpose of doing these bedside, or if you're in the operating room, you have to prepare an art line or a central line. We want to make sure that you understand what is sterile, how do you create a sterile field, and how do you get yourself gowned and gloved and ready to perform sterile duties. So here's some examples, and we can go back to the first thing that you're going to want to do. I'm going to pretend like this is my patient here, and I've just walked into the room. First thing I do, walk into the room, I perform hand hygiene because I'm going to talk to the patient, and I check, make sure, verify information. You have checklists that you have to follow when you talk to the patient. Verify that the correct information is going to happen. You have the correct consent. The next thing I'm going to do is establish my sterile field, but I have to get into conscience mode. So when you get into sterile conscience mode, we have to cover our mouth. Your hair has to be pulled back. In most settings, you should have your hair pulled back in some type of a hairnet or cap. So I have to do all that before I establish my field. And a lot of people miss that step because they get really excited about opening, and you have to think about everything that you do before that. So the first thing, perform hand hygiene, take care of all documentation, verify the information is correct, get a consent, now establish the sterile field. So from here, I verified with my patient that we're going to be doing an A-line or art line. So from here, I need to be able to prep the skin and let it dry. Give it enough dry time for prepping of the skin, and then go ahead and get gloved up or gowned up for the procedure. Yes, and if you do need to move in, this is the time where we want to do it. So from here, I'm not going to open the package, but I'm going to go through the motions. I've established.
Sorry.
Yes.
Just one other thing, you guys, at that time too is also when you would do your Allen's test. Because
Okay.
you don't want to go crazy forward if you haven't passed the Allen's test.
So number 1 is Allen's test. And then 2, after you, well actually 1, hand hygiene, 2,
Make sure you get ready to see you guys.
Allen's test, 3, I have to prep. So you can do one of two things, just get your sterile field open, but it's always easier to take care of the prep and then go into sterile mode because now the arm is being prepped. So you follow the instructions on your prep. It could be a little stick that you crack and you perform a skin prep. When you do, have you been taught on skin prepping areas?
Circles.
Okay, you want to start at where you're prepping, at least 10 strokes, and move away and out. The idea is that you don't go from dirty to clean. Whatever you're cleaning, you have to go out and away from. So we've prepped the arm, and now I'm going to need to create my sterile area. I have a drape, a sterile drape. So with this sterile drape, you're going to have it open and first create a field with it. So I know that the edges I can't touch. So what I'm doing is peeling the package back and establishing the edges to create the sterile field. Now here's the tricky part with the towels. You have to be able to touch the ends to create the sterile field. So what you're gonna do is you're gonna pick up the towel. You've now touched a sterile item, but you wanna touch the inside of it. So you're creating the sterile field. Now this one has the fenestration in it. Trina, will you pull that paper away for me? We will pretend this is a full drape all the way across, and you create a space. Now I've seen this done with a towel, a drape, a small drape. The point is that you cannot touch what is on the inside right here. So there's a 2-inch border for me. Any supplies that I'm opening onto this field, I have to establish that border on my own. It's not established for you. So, let's see, non-fenestrated. Can you fold that up for me real quick? Let's show it to you the correct way. You're doing an art line. You want to have your supply open. I just ripped the edge. Can I use this? No. So I would go and get a new one right now. No question. I can't use it. The edge has been contaminated, so I go get a brand new one and open up your supplies. Sometimes you cannot let the package control you. You've got to control the package. So a couple things I will do is I need to create my open glove space and not reach over my sterile field. So, the supplies that I'll need, you just get it to the area you're gonna open it from. So you wanna get your supplies ready. Glove is open. I know that the edges, how far around the edges do I have to worry about? 2 inches. And then this supplies you would have open and ready for you. Onto your sterile surface. So from here, we're gonna go ahead and open glove for this technique. You take and pick up your glove by touching the inside that's folded out. You gotta tuck your thumb here. Step away from anything that's gonna contaminate you. A lot of people like to hang out right here because they think they're gonna drop the glove. All you have to do is pick up the glove, step back, tuck your thumb, point your hand towards the center, and then push with your right hand and pull up. As you can see, I'm not touching this glove. I'm touching the inside cuff that's gonna be touching my skin. So you can kind of work that cuff up to get it in a safe mode so you're not touching your skin. From here, I have to get the other glove on. So a lot of people struggle with packages. Once I have this glove and I know where my border is, I can hold the package to get control of my glove, as long as I don't touch the sterile item. And I'm within that 2-inch border, right at the edge. Pick your glove up, step back, and you have to take your fingers, you're gonna create a little opening, tuck your thumb, pull out towards you with the glove and up. And if it goes like this and you made a mess, just wait till you can get it in a normal position. Adjust the glove without touching the very end. Get your gloves on. And this is where you have to take the time to straighten yourself out. So from here, I know I've lost some distance on sterility. Probably about that end on my glove. I'm gonna assume that's not safe to touch down there anymore. This is safe to touch. So now I have to create my sterile field with my items. Tucking your hands behind to protect your glove, and you just create the space for yourself, okay? And then from here, the sterile supplies that you have that need to be open to you, depending on where your setting is and how it's done, you're gonna wanna get that sterile field opened and created like this, and get your supplies onto it and start your art line from there, okay? The reason why I didn't open this package, which I can do it so you all can see how to open these packages, is because my little space right there wasn't big enough. I needed the mayo stand to open the space up. So once you've created a sterile field, that's where you can open your supplies onto it. Okay, so any type of package that looks like it is just single packed, you can go ahead and open. If you ever come across a package that's double peel packed like this, you can't present this to the sterile field. You have to either present the item to somebody sterile or set it up on a surface and open it up to present the item to be picked up from here, okay? So for something similar to the line, how you open pill packs, you wanna start your edges. If you don't start these, it makes it hard to open pill packs. So you wanna start the edge, And the idea is that you're peeling this package back in a way, you have to walk your hands down the end of it. And some of the packages are hard to open. Okay, so I'm gonna stop right here. I'm gonna do the art line. I just wanted to show you that edge, that if you don't start the edges, it's hard to open, you'll tear the center. So for here, started my edges, start to open, and this is where everybody freaks out because the contents are gonna start popping all over the place. You have to get in a place, get your stands. I can't go over the field like this, but I can be off to the side. Open your package about halfway and try, from here is when you present it to the field. It's not more of a popping mechanism, it's opening and let the package open for you. So at halfway, you wanna make sure none of the edges have rolled in. You can't go back and forth like this. It has to be a clear open and deliver these contents to the field and step back. The idea is you cannot have the package hanging out over the field because the outside of this package is not sterile. The inside surface within the wrapper and here, if you present that to the field, that is the sterile side. You just can't hang out over here. Okay, so it's very hard, it takes time. Little packages like this, sometimes you just get them ready. Start the edges a little. If I had to get this onto the field, I would go slow and deliberate. Just like the video says, you have to think about your movement. Peel the edges back. This looks like it's gonna jump out at me. So I'm slowing down my movements, get control of the package, pop it on the field and step back. Next is the most difficult one, and I'm showing you guys this now because everybody struggles with gloves. I'm just putting another glove up so you can see. Depending on if the glove is in a long package like this or a small package, but this is the package that everybody struggles with. And then when you rewrap for your skill, you're gonna probably wanna pick a package about this size and have your glove already situated perfectly in there. Because when you're practicing for your skill, you have to remember you're rewrapping it. You have to set yourself up for success. So get a pill pack, line the pack up or your glove back up in there perfectly so that when you do go to open, it's set up like the manufacturer presented it. So this here, a little bit harder. You've got to practice a few times with these packages. Start your edges, peel back. Now, a lot of people get overworked about, I noticed that that package moved the drape and it says you can't move the drapes once they're down. What you will do is just assume right here, you just lessen the amount of sterility that's left. So once I get sterile, I can position, I can't move that drape around, but I can position my sterile contents so that they're not nearer the edge. So sterility when you're at the field, it's kind of invisible, right? Only you know where the area is sterile, so you have to give yourself more distance and limit the amount of contamination that happens, which you should have 0 contamination on these, okay? So from here, we're gonna pretend like I didn't contaminate the patient's arm with my packages, because I couldn't do that. I just prepped the patient's arm. I can't set anything on top of their skin, because that's not appropriate. They've just been prepped for the procedure. And then from here, I have to get my folded fenestrated drape onto the field, because that's gonna go for the arm. And then I just wanna confirm this is open glove technique, right? Okay, so your towel drape, again, when you guys, once you open it the first time, the second time it's gonna be kind of like this. Get control of your package. Understand that I know my thumb is on the inside. Where I touch there, I have to watch my distance so my hand doesn't get in contact with anything. But you start your package, control it, and then just step up to your field, turn the package, and step away. A lot of people try to project and it gets frustrating because you have a very small space to work from. So you really have to focus on not letting your arms hang out over the field, because what's happening when I do this? Skin cells are just all over, and then it's gonna be placed and used on a patient. So think about your movements. Slow your movements down and remind yourself every single time. If you think you can practice this one time and be good, it takes years, you guys. And you have to do it over and over and over and over again. And even when somebody keeps telling you you're doing it wrong, you have to try to do it better each time.
I know you said it takes years to practice, but you got 3 months.
You got it. You got it. I promise you. What I'm trying to put your minds at ease understanding, this is a skill that over time you've developed. It's something that's going to be developed, but you cannot practice it one time and say, oh, I passed the skill. You will forget about it, and it'll be the day you're there with that patient that really needs you. And you're going to wish that you practiced 10 more times so that you didn't feel like you were fumbling trying to take care of the patient when all it was just practicing the skill to get your reps in, right? That's all we need to do is get the reps in, and then it'll come to us in the future. So from here, I'm going to do an open glove technique. Oh my goodness. I open my gloves onto the sterile field. What do?
Freak out.
Right, you freak out. You could get another glove, or if you do not contaminate, you can grab your glove like in a Foley. Nurses grab gloves out of the Foley pack, quickly pull away from the field, and we'll just pretend that I didn't open them there, that I had myself set up like a good instructor. And I'm gonna go ahead and open glove. I have my drape. So right here, before I get sterile, this is where my mind's like, okay, I can mess up here. I need to be able to prep my hands, so I'm going to pretend like I have some type of an Avogard or a hand prep available, because before I don sterile gloves, what do you have to do? Avogard, okay? So you need to perform that hygiene to your hands to get in asepsis mode. When I get in asepsis mode, the first thing I do I have a hat on? Do I have a mask on? Okay, if you've already not had a mask on, you got to throw away everything and start over, because you've just opened a sterile field without proper PPEs. Open up down in gloves, or sorry, just the gloves. So hard part about this is a lot of people struggle here. The only time you have to make your gloves perfect on a surface is during open glove, because you don't have a sterile field around you. And I'll show you the difference. So from here, I just grab the tabs, open it, and the bottom part, I just pop that underneath slightly. Now, we all know, where's the border? Okay, so for here, I'm open gloving. I can just pick up my glove, prepared it a little bit better to get that opening. Where's my thumb go?
Inside, yeah.
Tuck the thumb, slide this up, so I can touch as much as I need to get myself straight. Was I getting close to my field?
Yeah, you were.
You guys have to be able to point that out. If you catch somebody doing what they shouldn't be doing, you should be able to say you're contaminated. You're getting close to the field. It's okay to correct each other out there. So this hand comes in and tuck the thumb, create an opening, slide that hand in, tuck the thumb, pull back, push up, and you do want to straighten your gloves out, because if you're dealing with sharps, that's when you get hurt, when the glove catches a sharp. So from here, I know this edge, I can pull that glove up, and I'm ready to start. The patient's arm has been prepped. It doesn't have any papers around it. There's a trash can close by to me. I'm gonna go ahead and place the drape. So you pick your drape up, step away from the field. So many people like to get things ready over here. If you're gonna contaminate, you're gonna contaminate everything. So just step away, open the drape. I'm trying to find the best way. Just fold it out, pinch the top layer, and let the drape fall, literally on the ground. So from here, you tuck your hand, I've covered my gloves. Can you see my glove on the other side?
No.
That means I won't contaminate myself. And then I approach the field, set the drape down, and I go back to my sterile conscience mode, because I can't do this. What did I just do?
Touch yourself.
Right, but I do want to stay above my waist. So it's kind of like this ballet mode. It's really weird. We kind of just get in it and you stay in it, and so your arms are out. You want to know that you're sterile from here to here, so your arms can't come close to your body. Open gloving is difficult. It's more difficult than sterile. So from here to here, I can reach over the field. If you needed to move things on the field, you don't touch the edge and drag this over, because what did I just do? Big time. So I touch the inside of the Tootsie Roll, use my limbs and help to scoot things over. Everything in the operating room or the hospital is on wheels for a reason. If you're not using the wheels around you, you're gonna struggle in some scenarios, okay? Any questions on how to get supplies onto a sterile field? Okay, that's one way of doing it. Question?
So all this is without a gown.
This is everything without a gown. Now the hard part is the gown and glove technique. So I'm gonna be working mostly from this spot right here. I'm gonna kind of stick that out. Okay, so what do I have to do? I'm getting ready to gown and glove for assisting with the chest tube, okay? I need to make sure I have a